we're very fortunate to have Zain Mita, who's one of our fantastic SHOs, and he's going to be presenting on a topic quite close to my heart. It's all about alcohol, which, in my opinion, after the COVID wave, will be really what we call the second unknown wave, the wave of alcohol-related problems and the wave of psychiatric health issues that are going to come our way as a result of the COVID pandemic. So Zain's going to go through a few cases about alcohol detox, which can be done well and can be done poorly as well. And I think that's a very pertinent topic, since you'll be getting a lot more patients coming to A&E and medicine with acute alcohol-related issues. And he's going to also give us a little bit more of a briefing about the latest updates in management of alcoholic hepatitis. So Zain, thanks for joining us. If you want to, you can share your screen now and fire away.
Thank you, Dr. Fong. Hi, everyone. As Dr. Fong said, my name is Zain, one of the gastroenterology F2s. I'm just going to share my screen with you. Can we all see that the screen at the moment?
Yep, okay. That looks fine.
By the silence that I'll carry on. All right. So as Dr. Fong mentioned, today I'm going to be talking a little bit about alcohol-related disease. Obviously, this is a wide topic, so I'll be focusing on two cases that I thought had good learning points for us all. The cases are real-life cases. They are from outside the trust, but I'll just get straight on and tell you about them. So the first case study was a 63-year-old gentleman that presented to A&E with alcohol excess and bilateral pneumonia. He has a background of having previous admissions for alcohol excess, obesity, COPD, and untreated hepatitis C. On his third day of admission, he was found to be tachycardic and sweating, and the ward team thought that he was withdrawing from alcohol, and he was initiated on an alcohol detox regime. Over the course of the next 4 days, his symptoms continued to worsen. He started to experience auditory and visual hallucinations. He became disorientated. He had worsening hypertension despite ongoing chlordiazepam administration. So based on that, can anybody tell me what the dose of chlordiazepam this patient should be receiving, or whether we need to do anything else for him in terms of assessment before we make that decision?
What I'd say in following Zain's question is, if you want to, you can just send it on the chat group what you think your answer would be. You can also put down in the chat group any questions, additional information you would want to help you make that decision about what level of detox you're giving this patient. Anything that you would want to know more about the patient. So we'll give you a minute or two to think that over, and it'd be really helpful if any of you can write your answers in the chat group, because a bit of interaction is useful for this one. It gives me a better idea about what people are thinking about.
Also, on that note, Dr. Fong, I'm not able to see the chat group as I've got my presentation up. Would you be able to let me know what people are saying? Thank you.
No problem. So we've got Anand saying Siya. So I think what he's asking is for a Siwa score, which is very pertinent. That's good you've asked that. I'm very glad you're aware of it. We're going to make it a little bit harder for you, Anand, and we're going to probably get you to get a rough idea about how you calculate it in a bit. But following on to that question, I guess you want to ask about symptoms of withdrawal. Having said that, let's just say broadly that his CWA score is quite high. What would you want to give him?
So actually, if I tell you that his CWA score was 18, for example, does that help you, or does that change your mind at all?
Okay. Well, I think we've given them enough time. I think they might still be digesting that information.
Okay, cool.
So why don't you go ahead, Zain? Let's see what
Yeah,
let's see what we.
so at the moment in the trust, we have an alcohol detox regime that looks a little bit like this. This is a snapshot from the guidelines that we use at the moment.